I'm Ganesh Baliah. I qualified as a podiatrist in 2003. I studied at the University of Northampton and specialised in biomechanics and paediatrics initially. My current role is as a clinical fellow, but no clinical involvement. So I'm working half of my week with the Director of Human Resources, looking at strategies around retaining clinical staff across Northamptonshire. And the other half of the week I'm working with the Director of Nursing and Quality, looking at clinical engagement, and I'm also the AHP lead for Northamptonshire. When I first started podiatry, my motivation was to move towards sports injury and rehabilitation. And in my first year from our anatomy course at Leicester Medical School, our course tutor, who was a paediatric surgeon himself, advised that we could move into that area. So from that day, really, my driver was to become a podiatric surgeon. But with children and lifestyle changes, I had to make a career decision as to whether to continue down the surgical route or look at alternatives that would challenge me equally, and that's what brought me down the leadership path. Moving away from my clinical post and moving into leadership and managerial role, straight away I was starting from zero. So it was a very steep learning curve, and the benefit of the fellowship is that you have that scope to go and learn, pick up on areas where you may find weak, and go and spend some time in those areas to develop yourself. I started my fellowship in May 2017. That followed on from conversations with our Human Resources Director and Director of Strategy, whom I approached to discuss my career change and moving towards the board. And they discussed the potential for a talent management plan and highlighted the Health Education England fellowships, and what that has done has allowed me to press the reset button and look at areas where I need to strengthen and how I would get the resource to develop. And so Health Education England has absolutely helped with my resource and my postgraduate training since starting the fellowship, but also having that title allows you to, it opens doors for you. So I'm sat in on important meetings. I'm making myself integral to those roles also, and it's absolutely the fellowship and the title of the fellowship that has changed that. I think what my journey demonstrates is that being an AHP doesn't limit one's career choices. Don't think of yourself as just a therapist. Behave and think like a leader, and you'll follow that route. I absolutely love my role now and the opportunities that are ahead of me as an AHP. I'm very proud of the career path I've taken. I think what makes me more proud is my previous mentors and clinical leads, are gushing at how well I've done and how well I will continue to do. I think on a personal note, my own family have noticed how much more relaxed I am now and enjoying the role. There's less pressure I feel on myself, despite it being a high pressure role. And that perhaps speaks volumes about where I see myself and what my drivers are in pushing my career forwards.